In this video, we are going to discuss about a common work-related musculoskeletal disorder known as carpal tunnel syndrome, a work-related disorder which is painful, caused by a repeated trauma due to regular work exposure. Before moving on, let me introduce our group members. They are Ihan, Carlo, Fujin, Jasmine, Rosemary, and me, Kenneth. There are 5 major table content in our present. There are objective, introduction and stats, risk factors and how it will affect the patients, methods and ways to reduce the chance of development, and lastly, treatment and intervention. The objectives of this presentation are aiming to discover on how the syndrome affects the patients, identify the prevention potential as well as what we can do to help the affected populations. And next, I will be passing to Rosemary.
Thank you, Kenneth. Carpal tunnel syndrome is attributed to the nerve injury. It is due to the compression of the median nerve at the wrist caused by long exposure to physical occupational activities on hands and wrists, for example, typing and certain sport activities. This resulting in squeezing and irritating the median nerve in the carpal tunnel area that usually provide the sensory and motor function to our thumbs and 3 middle fingers. Individuals work in occupational groups like carpenter, silver, driver, assembly line worker, or a heavy keyboard user are more likely to put in at risk on this syndrome. This is about the statistic. Carpal tunnel syndrome is one of the most common hand conditions that is progressive and will become worsened if without the proper care. With 300,000 to 500,000 surgeries performed each year to correct this condition and affecting as many as 1.9 million people in the world. Next, Ihan will take over to discuss about the risk factor.
Thank you, Rosemary. Next, here are some risk factors that contribute to this disorder. First and foremost, anatomical aspects. The space between the carpal tunnel may change due to a wrist fracture, dislocation, or arthritis that deforms the tiny bones of the wrist and places pressure on the median nerve. Next, sex or gender. In general, women are more likely to develop carpal tunnel syndrome. This may be due to the fact that women's carpal tunnel syndrome develops less severely than men's. Besides the neurological disorders, the risk of nerve damage, particularly damage to the median nerve, is increased by a number of chronic conditions, including diabetes. In addition, inflammation-related illnesses. The lining around the tendons in the wrist can be impacted by rheumatoid arthritis and other inflammatory diseases. Furthermore, obesity. Obesity increases the likelihood of developing carpal tunnel syndrome. Finally, workplace variable. Working with a vibrating equipment or an assembly line that necessitates prolonged or repetitive wrist flexion can put damaging pressure on the median nerve. This is especially true if the activity is done in a cold environment. So you might be wondering now, how carpal tunnel syndrome does it affect the patient? Next slide, please. On your wrist, tapping on a computer keyboard all day can be taxing. Day after day of typing of extended periods of time might lead to some serious discomfort. Carpal tunnel syndrome may be the cause of tingling, discomfort, and numbness you experience in your hands or wrists. Carpal tunnel syndrome can be brought on by performing any repetitive motions with your hands, such as typing, stitching, operating vehicle, or writing. The median nerve is compressed when a repetitive motion, particularly flexing and extending the wrist, is made. Numbness and tingling in the hand, including the thumb, index, middle, and half of the ring finger, are the typical symptoms of carpal tunnel syndrome. Usually at night, the discomfort is the worst. Anytime you experience the pain may extend to your wrist to your elbow and not be able to grip objects as firmly as the affected hand. Next, I will pass it on to Carlo to continue with the methods to detect carpal tunnel syndrome.
Thank you, Ihan. I'm Carlo, and I will be explaining about the method to diagnose carpal tunnel syndrome. First and foremost, physical examination. The doctor may press on the nerve or bend the wrist of the patient to assess the strength of the hand muscles. Symptoms such as pain will then appear very soon in many cases of carpal tunnel syndrome. Next, X-ray. You might wonder how X-ray diagnose carpal tunnel syndrome. But actually, X-ray is not directly used to diagnose carpal tunnel syndrome, but it is used to exclude other diseases such as arthritis that will also cause wrist pain, which is also the same symptom as carpal tunnel syndrome. Third, electromyography. What is electromyography? Based on Mayo Clinic, electromyography is used to differentiate whether the wrist pain is caused by damage to muscle cells or nerve. During electromyography, a thin needle electrode is inserted into the skin and finally to the muscles. Electrical activity of the muscle cells will then be assessed. Next, ultrasonography. Ultrasound is used to capture a picture of the median nerve and determine whether it is being compressed or not. Lastly, nerve conduction study. NYU Langone Health stated that nerve conduction study is a method to measure the speed of transmission of nerve impulse. If there's low transmission of nerve impulse in carpal tunnel, the individual is highly suspected to have carpal tunnel syndrome. Thank you, and I will pass it on to Fujin.
Thank you, Carlo. Speaking about ways to reduce the development of carpal tunnel syndrome, there are numerous methods to do so, and I would like to briefly discuss some of the points from our research. Starting from reducing our force when typing or writing. Using a pen that has a softer grip or typing softly on the keyboard can both help to reduce tension applied on the median nerve. Also, it is best for us to not work long hours continuously because force is applied on our median nerve in our wrist during typing or writing. Having short breaks and stretching our wrists can help to relax the median nerve. Moving on, sitting in an improper posture may cause excessive tension on the neck and eventually the median nerve, which originates from the nerve that is from the neck. And when the nerve from the neck is experiencing tension, the median nerve may be affected as well. Other than that, choosing a suitable computer mouse, such as an ergonomic mouse, which is now available widely in the market, can easily help us prevent excessive tension on our wrist. Also, from a medical research by Wheeler 2021, it is proven that working in a cold environment will cause the median nerve in our wrist to stiffen. As for this generation, most offices are air conditioned. We are advised to wear a wrist brace while working to keep our wrist warm. And lastly, if all else fails, it is advisable to look for another role or job that may require less usage of wrist if possible. And now I will pass the time to Jasmine, who will talk more about the treatments.
Fujin. Now I'll be talking about the treatments available for carpal tunnel syndrome. Firstly, the widely used one are wrist splinting and surgery. Wrist splinting is a splint that holds the wrist in place to reduce symptoms like feeling tingly and numbness at night. Pregnant women are advised to take wrist splinting as a measure to counter carpal tunnel as it is non-invasive and drug-free. Next, carpal tunnel surgery. It works by relieving pressure via cutting the ligament pressing on the median nerve. There is endoscopic surgery or also open surgery. Now, onto more unconventional methods, it will be acupuncture and heat and ice therapy. Research have proven that acupuncture can effectively relieve carpal tunnel syndrome. Moving on to heat and ice therapy, it can also relieve pain. Ice therapy relieves pressure on the nerves, and heat therapy relaxes the tense, tight muscles and nerves. In Chinese medicine, there is something called as evil bone water, which can further penetrate deeply and heal carpal tunnel pain. Now I'll pass it on to Fujin for the intervention.
In terms of our intervention, we thought of something which is quite innovative and simple, and most importantly, it is practical. What you are looking at is our own intervention, an inclined armrest board which is cushioned. So instead of resting our arms or wrists on the table while typing or moving the mouse for a long period of time during work, which would hurt our hands, we can now rest our arms and wrists on this cushion board, which is inclined to around 20 to 30 degrees, and help us maintain the right typing posture, even though we are working for a long period of time. In terms of the affordability of this intervention, the cushion inclined armrest board is relatively affordable, as the raw materials that are needed to create this product is just plastic, which gives the triangular shape, and memory foam, which gives the softness and comfiness of our intervention, the inclined armrest board. And now I will pass the time to Kenneth, who will conclude the presentation.
Thank you, Fujin. To conclude everything, there is presently no way to totally remove the possibility of developing the carpal tunnel syndrome. Thus, we should not burden our hands and remember to take a long break after a period of work. Thank you so much. And this is our reference list.